The late Ed Cafruny was a colleague of mine in the days when we were both assistant professors of pharmacology at the University of Michigan Medical School. Before he joined our faculty, he was a graduate student at another university. Before that, he was an infantryman in the United States Army, and that is where he got wounded. Toward the end of World War II, Ed was among the soldiers who had invaded German territory, and they were going from house to house looking for German soldiers who had not returned with their compatriots. Ed entered a room in such a house, rifle in hand, and shouted, "Are there any blank blank Germans in here?" He was looking straight ahead, not down at the floor, where an armed German soldier was lying with his rifle in his hands. The German fired upward towards Ed, and the bullet struck Ed in the face, shattering his left cheekbone. Ed was evacuated to a military hospital in Paris, where the surgeons performed a preliminary repair of his face and then shipped him back to the United States for the definitive reconstruction. Apparently they did a good job on him, because by the time that I met Ed, his wound was not at all obvious. However, he had a pain in the neck, which lasted for 10 years. All through his convalescence and college and graduate school, Ed complained, but to no avail. Various doctors examined him, but could find nothing to explain the alleged pain, so they put him on the analgesic drug codeine. Many people believe that codeine is not an addictive drug, but Ed swore that he became a codeine addict during the course of the decade of a pain in the neck. Ed completed the requirements for the PhD degree in pharmacology, but before he was permitted to leave the graduate program, his university required him to get a chest x-ray. Ed was working in the laboratory with monkeys, and some monkeys have an infection with a variety of tuberculosis germ, which is also infectious to humans. So Ed went over to the health service and got a chest x-ray. The very next day, the head of the health service phoned Ed and summoned him to his office. Fearing that he had contracted TB from one of the monkeys, Ed responded to the summons with alacrity. The head of the health service greeted Ed with, "All right, wise guy, what are you trying to do?" The health service guy then produced Ed's x-ray. It was obvious immediately that the technician had aimed the camera higher than usual, because the x-ray image included more of Ed's head and less of Ed's chest than usual. Just sloppy technique, but lucky for Ed. Superimposed on the left side of Ed's neck was the unmistakable image of a detached blade from a Bard Parker surgical knife. The head of the health service continued his rant. "We figured out what you did. You used Scotch tape to stick a knife blade on your neck so that the x-ray would give us a cheap thrill." Ed was simultaneously overjoyed to discover an explanation for his sore neck of 10 years' duration, and disgusted with the health service head for his failure to interpret the X-ray film correctly. Eventually, Ed persuaded the head man that he was not playing games with him and that he did have a knife blade in his neck. Ed was referred to a surgeon. Ed's request was quite simple and straightforward. Please take the knife blade out of my neck. The surgeon's reply surprised Ed. The neck is a complicated structure, and it is very possible that if I operated, I would not be able to find the knife blade. Then things would be worse than they are now, he said. The then surgeon uttered the remark that provides this story with a title. Since it isn't causing any trouble, leave it alone. And that, after 10 years of codeine addiction, Ed said, take it out. And the surgeon did. The surgeon had no trouble finding the blade. It was situated parallel to the left common carotid artery, which delivers blood to the brain. Over the years, the blade had managed to cut halfway through the wall of the artery, and probably a minor nudge at just the right angle would put it all the way through. One is reminded of a sword of Damocles.